Good afternoon. Welcome to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang.
Here.
Senator Nguyen.
Here.
Senator Titus.
Here.
Senator Stone. Chair Donate.
Here. And everyone is present, so thank you so much, and mark all the committee members as here. Welcome everyone to the Senate Committee on Health and Human Services. Today we will have a short briefing. We have a hearing on Senate Bill 109, and so I do have a few housekeeping items before we begin. Agenda items may be taken in a different order, but we only have one today, so I doubt that will happen today. We ask that public comments be kept to 2 minutes so that everyone interested in speaking can be accommodated. We do have a new toy in the committee. There's a timer now installed in the dais, so obviously please pay attention to it. If you wish to testify, you can always sign in at the table by the door and provide a business card to the committee secretary. Just as a reminder that if you do go over the 2 minutes, we do ask that you submit your testimony either in support, opposition, or neutral to our committee staff. When testifying, please turn the microphones on to speak and off to listen. And a reminder that anyone who wishes to receive copies of the committee's exhibits could go to the Nevada Legislature's website. At this time, I will go ahead and open the hearing on Senate Bill 109. This bill revises provisions relating to anatomical gifts. And we have with us Vice Chair Rochelle Nguyen, who will be presenting the bill. So please proceed when you are ready.
Good afternoon, Chair Donate and members of the Senate Health and Human Services Committee. I have the honor today of presenting Senate Bill 109. Along with me to help present Senate Bill 109 is Salahi. I knew I was going to mess that up, you guys. I practiced it multiple times, and she just told me. She is a Senate legislative intern from UNLV. As many of you know, I love to present and incorporate people into the process that are our future leaders, and she is definitely one of those people. Also here to present and kind of walk us through the bill and some of the proposed conceptual amendments is Dan Musgrove with Strategies 360 on behalf of the Nevada Donor Network. Is that correct? Did I get that all right in there? Wonderful. So at this time, I will turn this over to Saha.
Good afternoon, Chair Danyate and members of the Senate Health and Human Services Committee. My name is Saha Salahi, that's S-A-H-A-S-A-L-A-H-I for the record. It's official. In 2022, the U.S. reached 1 million organ transplants, more than any other country. Together, the organ donation and transplant community has made life-saving history. But this is only the beginning. With over 600 Nevadans and 105,000 patients nationwide on the waiting list for a life-saving transplant, we're working to reach the next 1 million even sooner. Critically ill patients needing an organ must face the financial, physical, and emotional burdens of awaiting a life-saving organ transplant, and for Nevadans, that most likely means traveling to neighboring states to get the care that they need. Despite the continuing efforts at public education, misconceptions and inaccuracies about donation persist. And the opponents of SB 109 may in fact be helping to propagate some of those myths today. While specific beliefs differ, all major religions in the United States support or encourage donation as a person's final act of love and charity in the world. I will now turn it over to Senator Nguyen to further explain how Nevada would join other states that provide protections to coroners, medical examiners, and the court.
Thank you. If you're sick or injured and admitted to a hospital, the number one priority of any hospital is to save your life. I know we have members on this as a part of this committee that know that oath so well. Organ donation can only be considered after death has been declared by a physician. Senate Bill 109 simply does what several other states, including Arizona, California, Florida, and Michigan, among others, have already done, which is to give coroners, medical examiners, and the court the ability to make a decision to save a life through donation if there is no one to speak on behalf of the deceased, and we have no indication that their last wishes might have been. We would hope that this final act of love and charity could be codified and enhanced by Senate Bill 109. I will point out just a couple of things, and I know Mr. Musgrove will go walk us through the bill and some of the amendments, but I think it's important to look at what our existing statute already authorizes and allows for. And this gives clarification. If you look at Section 5 of the bill on page 3, if you're looking at a physical copy, and you look at sections A through J, you will see that currently we have other people that can make these gifts before the decedent's death, including the spouse, adult children, parent, adult grandchildren, grandparents of the decedent. It's even as vague as enough to say an adult who exhibited special care or concern for the decedent, and persons who are acting under the guardians of the person of the decedent at the time of death. And this is the section that we hope to give clarification to. And any other person having the authority to dispose of the decedent's body. At this point, there is ambiguous or vague language that doesn't have the added protections that we are seeking to include in Senate Bill 109, where those individuals under that subsection J would now actually have to go also to a court or to have that guardianship appointment to have that added layer of protection to do that. So under existing law, there is the ability to do this, and this gives some extra added protections in that space. So at this time, I would like to turn this over to Mr. Musgrove to walk through the bill and some of the amendments that we were working with stakeholders on.
Chair Dunyate, Dan Musgrove, if I could, with your indulgence, I'd like to ask Jackie Warren, who's in Las Vegas, who is actually with Nevada Donor Network. She has a couple prepared remarks to make, and then I'll walk you through the bill if that's all right. Thank you, Senator.
Thank you. And good afternoon, Chair Donate and Senate committee members. My name is Jackie Warren. That is Jackie Warren for the record. And I am the Chief Quality Officer for Nevada Donor Network. And I am so appreciative of Senator Wynn's commitment to organ donation and having the opportunity to work with the Senator on this very important piece of legislation. As Senator Wynn said in her remarks, we believe this bill puts better protection into the law specifically for NRS 451 and the Uniform Anatomical Gift Act, which prescribes who has the authority to allow for these life-saving gifts for organ donation. Nevada Donor Network is one of 56 federally certified organ procurement organizations by the Centers of Medicaid and Medicare Services, or better known as CMS. We were founded in 1987. Nevada Donor Network's core purpose is to save and heal lives to more than 3 million people in our state of Nevada and thousands of potential transplant recipients. Our primary function as an organ procurement organization are to coordinate, recover, and allocate life-saving organs and healing tissues for transplantation and research on behalf of Nevada's heroic donors. Chapter 451.66 of the Nevada State Statute on Donation documents that an anatomical gift of a decedent's body or part for the purpose of transplantation, therapy, research, or education for organ and tissue donation may be made by any member of the stated classes of those persons. Senate Bill 109 further supports decision-making for donation for transplantation when there is no known person able to make this decision, and there is no evidence that a decedent has communicated their desire to not donate their anatomical gift. In these circumstances, this bill is proposing the ability for the coroner and/or the medical examiner to provide such authorization. Should the decedent not fall under the jurisdiction of either, the case would likely then be elevated to the court system for a decision to be made. Senate Bill 109 will make more organs available for recipients, shorten the wait list for transplant, and save more lives. And at this time, again, I would like to thank Senator Wynn for her sponsorship of this legislation, and I would ask for all of your support. Thank you.
Thank you, Jackie. Dan Musgrove on behalf of Nevada Donor Network, Senator Doñate, and committee members. I think it is so important for you to think about one thing that this bill does. This is the absolute last resort before we determine that somehow those viable organs will not be used for transplantation, because we have not been able to, through our due diligence, find someone who's able to make that decision. And that's what this bill does. It not only strengthens existing language, but it allows for, even better, that this decision can only be made for transplantation only, not for research, not for, as Jackie talked about, therapy or education. Again, we are trying to be very, very specific that after we've done all of our due diligence of looking for next of kin, determining if there's anyone to speak on their behalf, or whether the decedent has made a wish of being a donor or not being a donor, would we then ask the coroner or medical examiner, or in the case of a non-brain death, we would go to the court and ask them to decide whether we have done our due diligence and whether it's appropriate for transplantation. And so to walk you through the bill, again, and I want to just thank all of the stakeholders who I've been working with for the last couple of weeks, Clark County, Washoe County, the coroner, medical examiners, and a number of counties, the district courts. They have amendment that's on Nellis right now. We are absolutely in favor of that. They just wanted to make sure that it was specified that it's the district court that makes this decision. And then we're also continuing to work with the court. And I think the same language that I want to work with the court on is something that I think that will give the medical examiner a little bit more comfort as well. And so what we want to do is actually specify that, again, before we make either the petition or the ask of the coroner or medical examiner or the court, we have made sure that no person in the prior class, and as you look at section 5A through J, those are those prior classes, that no one under section 1 who is reasonable available objects to the making of the anatomical gift, and no evidence exists of the decedent having communicated a desire that his or her body or part not become an anatomical gift, including without limitation through a refusal that has not been revoked. So that's our intent, to put that into statute, to make sure that there are sufficient safeguards to ensure that if we have the ability to have a viable donor, and we have done the research in Clark County in the last 10 years, it's only happened 13 times that there has been someone that has no one to speak for them. But this would give us the opportunity to take potentially 13 organs or more and save 13 lives. And I think that's worth the consideration of SB 109. So with that, I'm open for any questions. Again, we are continuing to work with our stakeholders. We will have a formal amendment in writing. We also intend to give the coroner and medical examiner some civil or criminal liability for making this very narrow decision. And we have talked to NJA, and they have no issues with that as well, because it is a very specific exemption of liability. And so I think that hopefully that's clear enough, and we hope to get your support and open for any questions.
Thank you so much. At this time, I will ask my committee members if they have any questions. Senator Stone?
Well, thank you for the presentation. And I'm an organ donor myself. My family, all my family members, or most of them are as well. So I really understand the merits of the program that you're trying to do here today. But a few questions. So, you know, a lot of times when you get somebody in the hospital, they're taken off the street, they have a heart attack, which is, you know, maybe they're clinically dead, but they could be brought back with a CPR and they're going to the hospital. So you got this distinction between clinical death and biological death. And Dan, if you don't mind me calling you Dan, you mentioned that under a biological death, that there's nobody on this list in Section 5, that it then would go to court and they would make the decision, if this bill were to pass, that they could harvest the organs or not, right? And then, so what about clinical death? Is it the same terms for that? Or what would be an example of a clinical death where somebody could be having their organs taken from them?
Dan Musgrove on behalf of Nevada Donor Network, and maybe perhaps Jackie Warren might want to weigh in on this, or there is in Nevada, and Nevada actually was one of the first states to do this, there is a uniform declaration of brain death that is in statute. And so when that has been declared by a physician and others, then that is when we would ask the coroner to come in and release. If it's a non-declaration of brain death, so that someone is on life support, let's say their heart is failing, that is when we, after doing our due diligence, and we use the FBI database, the hospital assists us in looking for next of kin. Again, that is when we would then go to the court and ask them, with this evidence that we present them, that there is no other person that can make this decision. We would ask them to make that, not necessarily the declaration of death, because that would be done by the physician, but allowance for the transplantation of organs.
Okay. So these are obviously emergent situations. You get somebody that gets into the hospital. You only have a certain amount of time before, if let's say they're brain dead, that the other organs will begin to deteriorate and not be functionable anymore. Do you see a problem as far as time restraints in finding the next of kin or anybody here in Section 5 because of the limitations on time? And what happens if they can't be found and their organs are harvested and then somebody shows up and says, I'm here for Uncle Joe. Well, Uncle Joe has passed away. So that's the first trauma she's going to have to deal with. The second trauma she's going to have to deal with. And by the way, we gave up 5 of his organs to save 5 other lives, which is good news. But when you're grief-stricken, it can be a little bit frightening and alarming. So how do you handle the time constraints to make sure that the due diligence period can be exercised appropriately?
I appreciate the question, Senator. Chair, I'd like to ask Jackie Warren, because this is something that they deal with on a daily basis, and so I think perhaps she's better apt to answer that in Las Vegas.
Please proceed.
Thank you. And for the record, Jackie Warren. Just to elaborate on that, we do our due diligence. We work with the hospitals as well as what you had just referred to, as this patient is in the hospital and under their care. And so decisions are being made for their healthcare proxy when there is not somebody that is there. So in the meanwhile, we do work with different divisions within the hospitals themselves and also then within NDN. And we'll go through after 48 hours, 24 hours, depending on the severity or the condition of the individual. But we make sure that every stone has been turned and we are doing our best to try to locate. Most of the time we do, and is what Dan has just shared with you in the past 10 years when we have historically looked back on our data, that we have had 13 cases that this has risen. However, being said, while that is a small number, the significance of that could be very impactful when we are working towards saving lives and making sure that everyone has an advocate to speak for them when maybe their next to kin isn't available or they may be separated from those individuals in their life for an extended period of time.
Thank you.
And Senator Doñate, to the question, and the other thing is in the language, it's permissive, right? So if the coroner or medical examiner or the court doesn't feel like we've done our due diligence, we have that third party that can step up and say, you know what, we're not going to make that decision. I'm sorry. You're going to have to just not transplant those organs. And that's the right, and that's why we wanted someone else involved in the mix to help us make the best decision that we can.
Okay, I appreciate it. Just one follow-up and I'm finished. I want to go back to the differentiation between clinical death and biological death. So with biological death, you're talking about brain death. There's the chances of somebody coming back are virtually 100%. They're not coming back. But with clinical death, is there any extra steps to make sure that there is a second physician or a third physician that will verify that their heart is not going to be able to recover, their lungs are not going to be able to recover? Because we have heard of miracles. We've had people that actually gone to the morgue with clinical death and have woken up in the morgue. I mean, it's very rare, but it has happened. So we want to make sure that when we define somebody as really being dead, in other words, they're not coming back, that their organs can or cannot be harvested. So is there any extra protections for the definition of clinical death versus biological death?
if it's all right for me
Please
to
proceed.
answer.
Yep.
Okay, thank you. Jackie Warren again for the record. Because that individual has a clinical care team that in the hospital that are taking care of them, we rely on that medical expertise and also from a neurologist, and multiple tests are being performed to ensure that there are no signs, brain flex, brain stem reflex testing is some of the testing that we do. So there most certainly are a battery of tests that are performed to ensure that if there were any chance, most certainly a physician, a neurologist will not be signing off on a death declaration.
Okay, thank you very much.
Thank you so much. And in the bill, it references NRS 451.007, and in section 1, subsection B, it talks about for legal and medical purposes, a person is dead if the person has sustained an irreversible cessation of, and then it mentions all functions of the person's entire brain, including his or her brainstem, and then it goes into detail as what the comments were of the person and the qualifications and the quality standards to make that determination. So that's in reference to what's in section 1 of the bill. But Senator Titus.
Thank you, Mr. Chair. And first, thank you, Donor Network, and thank you for all the efforts you have. I've taken care of multiple patients that have had organ transplants, and I have called the Donor Network. I have had pronounced patients and done my due diligence in letting you know that there are potential organs to harvest and all of the above. So my questions in no way are intended to discredit what you do. I know there are not enough organs out there. I know that you do save lives, so thank you for that. As a physician, it is frequently a conversation I have with patients, end-of-life conversations. I passed in April 16th is the Medical Decisions Day, where it's important that we have that discussion, and you fill out your fuchsia paper, and it's called the PULST, which is Provider Observation of Life-Sustaining Choices type of thing. And so I think it's critical that people express their opinions on what they want done. On that same conversation, I've had many, many patients be adamant. I, for one, have it on my driver's license, as my mom did. You can take any part of me you want, right? I don't care. However, my father was adamant he did not want anything taken off. So patients have opinions that way. My concern with this is the 13 folks that you couldn't find the next of kin. They had no identification. Are we not perhaps focusing on that certain population of folks that wouldn't have an ID? The three I think of as the mentally ill, the homeless, and perhaps our illegal folks who are here and they have no IDs. They get into an accident. They're the ones that you can't find the next of kin because they don't have any ID there, and that would be the three main group of bodies that typically, if I get lost, hopefully somebody reports that I'm lost. But that group, I worry that this may focus on a certain group of our citizens that may have strong opinions on what they want done. How do you protect that group who are, I see, and I'd be curious to see the 13 that you couldn't find the next kin, where do they fall in our population? Does this unfairly focus on that population?
Go ahead, Jackie.
Okay, thank you. Jackie Warren again for the record. And thank you for your comments and your question. As it relates, and I don't want to dwell on the 13, but because that is the stat that we were able to provide, I can say that of those, 5 were without a home. The remaining, we were unable to do our due diligence and locate a next of kin. Now, there are circumstances by which we may know that there is a next of kin, and by all efforts, we are not able to make contact with them. I think when we go back to the Uniform Anatomical Gift Act in Section 5, and we do our diligence in making sure that we are looking for, whether it be a spouse or a parent or a child, there are provisions in there. And sometimes, there could be someone that someone is living with that we are able to find They may be homeless or, of a different sector. However, we're able to have those conversations to see if that individual did express any, if whether or not they supported donating or if they chose not to donate. So I think by going through this hierarchy, by doing our due diligence and doing our best efforts, we are trying to make sure if there is someone that is aware of what those intentions were for that individual, that we most certainly are trying to identify what that may have been.
And if I could, Senator Doniate, Dan Musgrove, to maybe add a little bit more. As you know, Senator, I've been working in the children's mental health and adult mental health arena for a very long time, as long as I've been coming up to the legislature. And there is often, even if a person is truly homeless, there is something that they have that gives them some kind of identification, whether it's the fact that they've accessed Medicaid or, there's sometimes we can come up with a name and figure out where maybe their homeless shelter was and figure out who they had as friends or family or something like that. Just as your father made his wishes expressed to you, we would do that due diligence to at least try to do that, because we certainly don't want to have someone, as Senator Stone brought up, showed up and wanted Uncle Joe back as Uncle Joe was. And so, again, we just think that in this case, there are enough protections that it's worth, I hate to say it as a gamble, but it's worth the ability to save a life. And I think anybody who would come along, again, these are folks that are going to die. And we would love to be able to give the gift of life to someone. And I think that's what we're asking the legislature to do, would be to consider this as that ultimate last resort opportunity to save additional lives.
Again, I appreciate all of that. And again, I appreciate what you're trying to do. There's also an increasing, and I don't mean to get too in the weeds or too sideways with this, and I think Senator Nguyen knows where I'm going to go with this one, but I am concerned that worldwide, there's such a lack of organs, and there's now the science for transplantation that there's an incredible black market for organ donations. And I am just anxious that by expanding, allowing a coroner, going to a judge, and this next step of who can donate, I'm concerned about possible abuse of this, and I know that may seem a little sideways, but just knowing worldwide how the black market for organ donation, and I hopefully that there's some other options that we can get more communications to folks, and I'll just finish the communications of availability to donate, how important it is to donate, education for folks to donate so that the black market maybe perhaps goes away. But I worry about, in desperation, we're expanding how to get these organs as opposed to educating on the options to give organs. So that's more of a statement.
And if I could respond to that, Rochelle Wynn for the record. I think this actually gives more protections. If you look at the existing statute, it says J, any other person having the authority to dispose of the decedent's body. So that is in the existing law. So what Senate Bill 109 does is actually increases those protections, increases the ability, gives more oversight potentially to this law that is already existing in statute. So the concerns that you have about a slippery slope or, expanding this, I would argue that this doesn't expand the existing law. In fact, it restricts it and has that added level of protection that if like an organization like the Nevada Donor Network comes in and goes through all this and there's some oversight that can say, you know what, I'm still not going to do it. I don't think you did enough. And that doesn't exist currently in statute. So, I would, argue that this doesn't expand this. This actually protects those same individuals and those same concerns that you have by further restricting and giving more, due process and oversight to that process.
Thank you, Senator Nguyen, for that clarification. Thank you, Senator Donate, for the question.
Senator Dan Musgrove, thank you, Senator Doniate. And again, as we talked about the 56 certified by CMS organ procurement organizations, there is no way under all of the federal guidelines and restrictions and guidance that we have to follow. And remember, we're working in a hospital situation. There's no way that any of us working in this space would come across or deal in a black market organ. I mean, this would be, again, this is under very strict guidelines and restrictions, and we hope that there isn't anybody out there that could use this statute under J, as the Senator Wynn talked about, who might be able to operate in this space. So thank you for your questions, and we appreciate your due diligence today.
Thank you so much. We have one more last question from Senator Stone before we go to testimony.
Yeah, I think Dan probably already answered it, because I was just going to say that it's the U.S. Department of Health and Human Services that approves these organ procurement centers, and I know that they have very rigorous standards to make sure that they are appropriately acquired, appropriately transported, and appropriately given to donors. Senator, you mentioned that there were a number of states. I think you said, what were they? Florida was one of them. 4 or 5 states that already have this in statute today. In those states, and maybe you don't know it, or maybe you do, have there been any legal issues as a result of those being passed in those respective states?
Rochelle Wynn for the record. The states that I mentioned were Arizona, California, Florida, and Michigan. And if I could turn, and that's a very diverse group of states politically and regionally and with their populations. So I think that's also important to note. I may turn it over to Jackie. She may have some information about that. I know I'd asked her to reach out previously about other programs that operated similarly to what we're proposing.
Thank you.
Jackie Warren for the record. Yes, and thank you. We have reached out to a variety of these states, and there have been no known problems that any of these organ procurement organizations have encountered because of this. Thank you.
Thank you so much. That concludes our round of questions, so we'll go ahead and move on to testimony in support of Senate Bill 109. As a reminder, please limit your testimony to 2 minutes each, and speakers are urged to avoid repetition. We will start with testimony in support from those in the physical locations, and then we'll move on to anyone who has called in. So is there anyone in Carson City that would like to provide testimony at this time in support?
Good afternoon, Chair Dunyate and the members of Senate Health and Human Services. My name is Tyree Gray, and I would like to rise in support of this bill. Personally, some of you may know me as a person who's served in this building for at least the past decade, if not a little bit longer. And I am an organ transplant recipient. And I know that every life that can be saved, every donation can save up to 8 lives and have impact on about 75 other lives. And so when we look at that relatively small number, even if you just do very, very simple math, there are possibly 80 other folks who could have been helped had this legislation have been in place. And so I just appreciate the fact that you guys are considering it today. And if you have any questions for me, I'm always happy to answer them.
Thank you so much. Please proceed.
Good afternoon, Chairman Donyate, members of the committee. For the record, my name is Cadence Matievich, representing Washoe County. We are in support of the bill and the intent of the bill. I guess perhaps I would say it's a little bit of a qualified support because I heard some things about amendments here today that we have not yet seen. But the discussions that we have been involved with so far, we are very much in favor of the intent behind this bill and look forward to seeing that final language. Thank you.
Thank you so much. Anyone else in Carson City, Las Vegas, and virtually?
Yes, Courtney Kaplan in Las Vegas.
Please proceed.
Thank you so much. Thank you so much for what you do for your public servants, and your due diligence and work is much appreciated. So I wanted to thank you for that. My name is Courtney Kaplan, and 4 years ago, my son Michael was killed in a motorcycle accident a week before graduation. Needless to say, I died with him that day, and my life has changed forever. But I will tell you this, being a proud mother of an organ donor, there is no greater pride. And while we're bouncing around the word gift, gifts are different for everybody, obviously. But when it comes to a gift of life, I would love to share with you what that looks like. 2 years after my son passed, I received a letter from one of Michael's organ recipients who received his liver. And the note basically read, "Thank you so much for the gift of life. I am able to watch my children grow. I am able to participate in their lives and go to their plays because of the gift of life." And what else it looks like is a 61-year-old male who got to watch his only son get married and welcome his first grandchild in. That's what the gift of life looks like. And what greater pride is there than to be a part of such a selfless gift of life? There is no greater gift. And for a mother, yes, I'm grieving. Yes, every day I miss him. I've been gifted with this extended family, as our dear recipient just said. That was the first thing I did after our honor walk, was to write a letter and welcoming all of our organ recipients to our family, because they carry a piece of my son. They live because my son said yes to organ tissue and eye donation. And I understand that this is, we're working on this bill for those that don't exactly fall under the same case that I had. However, as a family member, as a donor mom, there is no greater pride than knowing that your loved one has helped contribute to not only that family, but we're talking about a community. We all go home to somebody and with the family, and this is a community, this is a family, and there is no greater pride than to be able to be a part of that movement. So I am definitely in favor of the bill.
Thank you so much. Is there anyone else in Las Vegas that would like to testify at this time? Let's go to virtual.
Chair, there are no callers choosing to testify at this time.
Thank you so much. Is there anyone in this room that would like to provide testimony in opposition to Senate Bill 109? Anyone in Las Vegas? Anyone virtually?
Chair, there are no callers choosing to testify at this time.
Thank you so much. And last but not least, anyone to provide testimony in neutral on Senate Bill 109?
Good afternoon, Chair Donati, members of the committee. Joanna Jacob on behalf of Clark County. I just wanted to say I'm neutral today because we have been working with the donor network and Mr. Musgrove on the amendment as he put forth on the record today. I just also wanted to put something on the record from our coroner who has worked with the donor network on these cases. Brain death is death by law. The citation is 451.007 in section 1. And so that's when our jurisdiction starts. We have been asked to come to the hospital to fingerprint people who are without identification. So in an effort to do identification, this is, as Mr. Musgrove noted, permissive. So we intend to do our own due diligence as well and ensure that we can do all that we can in collaboration with the donor network and the hospital to identify next of kin. I did want to put that on the record. This is a very closely tracked process, and so we are very willing to be part of this conversation going forward. We'll continue to work on the amendments, and we appreciate the work that has been done so far by Mr. Musgrove and the donor network to put some of those protections in that for the coroner that are also being considered for the courts. Thank you.
Good afternoon. Andres Moses on behalf of the 8th Judicial District Court in Clark County, Nevada. Here in neutral today on SB 109. I just want to thank Senator Wynn and Mr. Musgrove for working with the courts on our concerns about the bill. The first was just clarifying that the district court does have jurisdiction over these petitions. And the second was just making sure that the petitioners do their due diligence before bringing in the petition. So we were very appreciative of him working with us on those, and we are here neutral.
Thank you, Chair, members of the committee. Jessica Ferrato here on behalf of the 2nd Judicial District Court. Again, just want to echo the comments of the 8th. Thank you, Senator Wynn, for your work on this bill, and to the Nevada Donor Network for allowing us to propose an amendment that clarifies the jurisdiction as well as sort of the order of operation that this needs to go in. So thank you very much.
Thank you so much. Anyone else? Anyone in Las Vegas? DPS, anyone virtually for neutral?
Chair, there are no callers choosing to testify at this time.
Thank you so much. Any closing remarks? All right, we'll go ahead and close the hearing on Senate Bill 109. Our last item on the agenda is public comment. Is there anyone that would like to provide public comment here in Carson City, in Las Vegas, and virtually?
Chair, the lines are open and working, but there are no callers at this time.
Thank you so much. If there are any comments from any of the members, that concludes our meeting for today. Our next meeting will be Tuesday, March 21st at 3:30 p.m. Thank you so much for joining us. Meeting's adjourned.